I wanted also to talk about the joint symposium ASH EHA. It is a symposium that I'm always attending because it brings up global research, which I think is very important. And it's also important for global standardization, especially harmonizing molecular diagnostic methods in clinical trials. And this year it was fantastic, didn't disappoint. It brought a lot of amazing data. It was this year, the joint session was devoted to menin inhibitors as novel targeted agents in the treatment of AML. And there were several themes that were brought up in this throughout this symposium. First of all, they defined the type of patients that will respond, and we should include in regimens containing menin inhibitors. And basically, there are specific mutations, patients that are harboring specific mutations, and they will certainly benefit from single agents or combination of these agents. They also went through the mechanism of actions and also the different types of resistance that can occur when utilizing these agents. They had wonderful presentations of epigenetic reprogramming, differentiation in induction, also emerging resistance mutations, and also adaptive pathways. The clinical data that they presented basically was an updated review of clinical trials with multiple menin inhibitors like revumenib and ziftomenib and a few others as well. And they looked at data across monotherapy trials, but also different combinations with hypomethylating agents, venetoclax, and even chemo. There was a lot of emphasis on the response in genetically defined subsets. And also there were a lot of MRD-directed approaches. The combination strategies were focused on targeting the right set of patients, and they were looking mostly at combining menin inhibitors with venetoclax or hypomethylating agents, and also the practical management of toxicities. As I was mentioning at the beginning, the symposium highlighted the role of international collaboration, which I think is very important. It's very important to accelerate development of studies because you have reached a bigger number of patients, but also a more varied technical background, especially considering that we are looking at a specific type of mutations in these patients. But also harmonizing the molecular diagnostic and making these targeted therapies accessible globally, because accessibility is also a big issue when we're talking about these new drugs. And I think right now, considering that the menin inhibitors are now seen as a central pillar for genetically defined AML subsets, the science is moving rapidly from early phase to more mature combination data. This symposium actually framed this paradigm shift as very important. It's going to be very tightly tied to molecular diagnostic and MRD.